towards the investigations which are done for the salivary glands. Basically, let's start it. Bismillahirrahmanirrahim. Number first, we'll study about salivometry, which I have told you that we do for the to determine the saliva, to measure the saliva. The whole unstimulated saliva. Sit quietly without talking and chewing or spit any saliva accumulated in the floor of mouth into the pre-weighed tube. Means if you want to measure the unstimulated saliva, the best way is that tell the patient to sit quietly. Okay, basically do not chew anything or do not spit anything, and that accumulated saliva in your floor of mouth is being taken in the tube for 5 to 15 minutes. You give, then you measure it like this. For unstimulated whole saliva, you chew a piece of paraffin or pre-weighed gauze, and then 15 minutes either. When you chew that thing, basically either it is a paraffin or gauze, then you to 15 minutes means you did for that, then either spit into the pre-weighed tube or basically in a weight basically the wet gauze pad. Okay, means the stimulated parotid saliva is a special suction cups which is kerosene, which is cups kerosene, which is these cups basically, which are cups of keratindine, collect in a pre-weighed tubes 5 to 15 minutes. You will do like this, and you can also do through the cannulation. Okay, so it's the way how you basically measure the stimulated and unstimulated saliva. Then number one, radiograph you also do. Now which radiographs do you do? First of all, you do plain radiograph. A plain radiograph show calculi. You can just see the calculi, or to view to be taken at 90 degree. It is actually you take it at 90 degree to see whether in your submandibular or in parotid region either there is any calculi or not. Panoramic is done for parotid, which is actually you do full OPG actually. Submandible you do OPG and lower occlusal view both. For parotid you do full actually mouth X-ray, but for submandibular you do also panoramic and lower occlusal views. Okay. Then salography you do basically. Salography is basically gland function or then ductal system obstruction. You want to know whether the glands are functioning or not, or whether the system is obstructed or not. Okay, a water soluble radio opaque means a water soluble radio opaque contrast medium is injected into the duct orifice and radiographs are taken. Means you give a patient a contrast medium which is ejected into the salivary gland duct. So whether it's a functioning or not, or either the duct is obstructed or not, it is called salography. Okay, it is a salography, you have to remember it. First we did plain radiograph, then we do salography. Now scintigraphy. Scintigraphy is radioisotope imaging. You inject in a technetium per technetate. Okay, so you inject whatever you inject the technetium per technetinate. Okay, then detect the generalized loss of glandular function in Sjogren's syndrome. Okay, so basically you did specially for the scintigraphy for Sjogren's syndrome that the function is lost or not. In these cases, you basically, if the function is lost, you consider it Sjogren's syndrome. Okay. Ultrasonography is basically done for the soft tissue swelling. You have also heard about the ultrasound, which is done actually for the soft tissues. So ultrasonography is the same. You do for superficial soft tissue swellings, chronic infection, or to detect the calculus. You also do that plain radiography for calculus obstruction. MRI is basically to detect the salivary glands expansion you want to see. Okay. you want to see the tumors, then good soft tissue details. If you want to know a proper soft tissues to do, you also do MRI for soft tissues also. Localization of masses, you see whether the mass is located or not. Okay. Cytochemistry is basically to know what are the constituents of saliva. Biopsy is done for intraoral biopsy of minor salivary glands like labial glands or FNAC of the major salivary glands. Okay, so intraoral biopsy is done for minor salivary glands like labial glands, and FNAC is done for the major glands actually. Now with this we have studied the investigations which is done. Number first we have studied about salometry. Salometry was done for to know the flow rate of stimulated or unstimulated. You measure through that actually. Then you read about the radiographs in which you have so basically you did a plain radiograph for the calculi obstruction. In parotid you just do OPG, and for submandibular you do both OPG and the occlusal view actually. Lower occlusal view you check the. Then you did for the in salography you check the obstruction and function. You actually inject a contrast medium in the duct. For scintigraphy you see the glandular function which is done in Sjogren's syndrome. Ultrasonography is done for the chronic infections or tissues, superficial tissue details. Then MRI is done for salivary gland tumors and for detail for the soft tissues, and the cytochemistry is done for the constituents of saliva, and biopsy is done for the minor salivary glands and for the major salivary glands tumors.